Hi guys, it's Dea, and today I'll be covering foundational cognitive behavioral approaches. This chapter discusses behavioral approaches, cognitive approaches, and cognitive behavioral approaches. Behavioral approaches concentrate on examining and intervening on measurable behaviors that are observed. Cognitive approaches were developed by Aaron Beck, and those are based on the assumption that irrational thoughts and beliefs are often found in psychological disorders, and in order for there to be improvement, those thoughts and beliefs have to be changed. Cognitive behavioral approaches are a combination of both cognitive and behavioral techniques to also change problem thoughts, behaviors, and feelings. There have been several different forms of approaches that fall under this, like multimodal therapy, rational emotive behavior therapy, or RABT, reality therapy, and mindfulness-based approaches. The ABC model created by Albert Ellis highlights the essence of all cognitive approaches. Our thoughts about a situation, not the situation itself, are the source of emotional and behavioral problems. This model was created to show how humans create their difficulties by the beliefs they have. According to Judith Beck, the cognitive model proposes that distorted or dysfunctional thinking, which influences the patient's mood and behavior, is common to all psychological disturbances. Realistic evaluation and modification of thinking procedures produces an improvement in mood and behavior. I'm going to go over an overview of the counseling process. The cognitive behavioral approach involves 4 steps. The first one is assessment, which consists of getting detailed information from the client about problem behaviors or thoughts, including how often they happen, how long they last, and what they are about. The second one is target behaviors or thoughts for change. In this, counselors look for specific thoughts and behaviors that they want to work on with the client. The third is educate. It consists of the counselor educating the client on their irrational thoughts in order for the client to get motivation to make changes. The fourth is replace and retrain. In this, the counselor provides the client with techniques so they are able to replace their irrational thoughts and behaviors with more positive ones. The relationship between the client and the counselor varies, but the main role of the counselor is to be the expert who directs and educates the client on how to better manage their problems. Judith Beck provided 5 practices for fostering the counseling alliance, and they are to actively collaborate with the client, demonstrate empathy, caring, and understanding, adapt one's counseling style, alleviate distress, and elicit feedback at the end of the session. Case conceptualization. In the beginning or before the first session, counselors conduct what is called a baseline assessment, and this gives them a starting point for measuring change. They ask their clients to write down how often, how long, and how severe a specific behavioral symptom occurs. That log may also include antecedents that could have triggered the symptoms. There is also functional analysis that is used to examine what a person was doing and thinking, and also what was happening in the environment before, during, or after an episode of the symptom. Some examples of questions for this analysis are: what were you doing before, during, and after the episode? Where were you? Who was around? And what time of day? Or, what was going on in your life at the time, during, and after? What were the normal activities? What were typical stressors? Aaron Beck's cognitive approach concentrated on identifying and change schemas and core beliefs that fuel problems in clients' lives. The 4 levels in his conceptualization of cognitions are automatic thoughts, which are automatic reactions to uncomfortable situations; intermediate beliefs, which are rules that shape automatic thoughts; core beliefs, which are just beliefs about ourselves; and schemas, which are developed during childhood, and they framework the mind that shape thoughts, feelings, and behaviors. Changing schemas are Beck's ultimate goal, and this was done by identifying distortions in automatic thoughts. Ellis assessed for irrational beliefs. 3 basic categories of these were perfection-based worth, which says I must be competent. These lead to feelings of anxiety and worthlessness. Justice for me. Other significant people in my life must treat me kindly at all times. This leads to feelings of anger. And effortless perfection. Things and conditions must be the way I want them to be. This leads to low frustration tolerances. Like I had previously mentioned, multimodal therapy falls under cognitive behavioral approaches. This therapy is created around the assessment of the basic ID: behavior, affect, sensation, imagery, cognition, interpersonal relationships, and drugs and biology. The questions under each section can be used for general global assessment or for a specific problem or symptom. This type of therapy fits the treatment to the client instead of the client having to adapt to the treatment. Goal setting. Counselors work with clients to figure out which beliefs and actions are resulting in problems and only change those. They don't have a specific list of normal thoughts and behaviors that everyone should have. The goals that are set forth are stated in behavioral and measurable terms and are usually written down in a contract. The long-term goal for this cognitive behavioral approach is for clients to be able to recognize their own irrational thoughts and behaviors on their own before they affect their mood, and to be able to resolve those thoughts on their own as well. Reality theory. Many elements of behavioral and cognitive approaches are incorporated into reality theory, and they are based on a different model of human motivation. Reality theory is based on choice theory. Choice theory states that the choices people make determine the quality of their lives. Counselors use this theory to identify actions clients choose that make the negative thoughts, feelings, and physical symptoms happen. In reality therapy, counselors take a look at the behavior of their clients in order to help them take responsibility for the quality of their lives and make choices to make their situations better by using the WDEP, Wants Doing Evaluation Planning. Wants means exploring wants, needs, and motivations. Doing means discussing what clients are doing and the resulting direction. Evaluation means evaluating the effectiveness of actions and choices. And planning means planning a course of action. Mindfulness-based approaches. This is another type of cognitive behavioral approaches, and it comes from religious and spiritual traditions. These approaches accept difficult thoughts and emotions in order to be able to transform them. Counselors encourage clients to take a look at difficult thoughts and feelings without the intention of changing them. The most common type of mindfulness-based approaches involves watching your breath while quieting the mind of inner chatters and thoughts. Specific mindfulness approaches are mindfulness-based stress reduction, mindfulness-based cognitive therapy, dialectical behavior therapy, and acceptance and commitment therapy. Working with diverse populations. The emphasis on the expert's stance when it comes to working with the clients has strengths and weaknesses when working with different populations. Counselors have to pay attention to unintentionally perpetuating dominant cultural norms. They also need to look over treatment goals to make sure that they don't interfere with religious, cultural, racial, socioeconomic, or other values of culture. CBT has shown to be culturally consistent with Hispanic and Latino cultures. Some things to watch out for are that Spanish-speaking therapists need to consider not only being able to translate words, but concepts across cultures. Therapists also need to make sure not to consider a Latino's choice to put family above their own needs as irrational behaviors, because family is an important thing in that culture. It is also ideal for working with African Americans because it helps them to dispute problematic social beliefs, and there is a focus on present behaviors. Techniques of this approach can be used to help identify and dispute stereotypes and expectations that they have internalized for the broader culture. CBT may be difficult to apply to Chinese Americans because they may not be as comfortable discussing or expressing their emotions. For working with people in the LGBTQ community, therapists need to examine the role that societal norms and stigma play in the development of the client's beliefs. They have additional areas of stress like the development of their identity, acts of harassment, or stress due to social stigma. Research. Cognitive behavioral therapy is the most researched approach. Counselors combine research into developing their theory in order to be able to find specific interventions for specific populations. Cognitive behavior therapy dominates the National Institute for Mental Health's list of evidence-based treatments. Some examples on this list are CBT for panic disorder, CBT for generalized anxiety disorder, and behavior therapy for depression, and many more. Because research is constantly being done, counselors are able to know how effective their methods are. A meta-analysis of well-controlled studies on CBT showed that CBT was not very effective when it came to preventing relapse of schizophrenia, but it was effective in reducing relapse and depression in a very small amount. It was also not effective when it came to avoiding relapse in bipolar disorder. Even though there has been endless research, there is still not a simple answer for what works best. This concludes my video on cognitive behavioral approaches.